So, Toronto or Toronto, amazing. It's 4 o'clock. You're still networking. You're still speaking. You're still coming up with ideas. And you're still not putting them on the board. So, could you, for me, please pick out those cards, write on those cards, pledge what you're going to do, because that will help us when we are writing this up. In front of you, on the desk, there are cards. Take them, fill them in. You've got ideas now. You've been speaking, you've been listening, you've been sharing, and we need to harvest those ideas because we need to advance. So, we have had a full day, yes? Yeah? I have the honor to introduce our keynote speaker, Lord Victor Abadiwala, who I have known for many years. When he was a younger peer than he is at the moment, I used to have the pleasure of going to the houses of House of Lords in the UK to try and work on trying to work out how to improve mental health services for black and minority ethnic groups. And we finally launched a document called Delivering Race Equality. And then he was shocked that I said, we've done that, now I'm leaving the country. Yes. But it was amazing to see at that time to be able to look upward to somebody who had succeeded so highly, who worked with such passion and authenticity, and who was an amazing role model, even though I think he might actually be younger than me. But it was amazing to be able to do that. And when we thought of our, this inaugural conference, this inaugural Wellesley conference, I couldn't think of anybody better, anybody who, if I was asked, I'd want to share with all of you, all of my peers and friends and the people I work with in the sector, than Victor. He is the non-executive director of the cooperative group, Collaborate CIC, Visionable and Leadership in Mind. He is also the chair of Social Enterprise UK. Victor has recently stood down after 6 years as a non-executive director of the board of the National Health Service of England. He has chaired a number of commission reports into policing, employment, mental health, housing and fairness for the London Fairness Commission, and also worked for the Metropolitan Police and for central and local government. He was awarded the CBE, Commander of the British Empire, for services to the unemployed and to homeless people, and became a crossbench peer in 2001. He's a visiting professor and chancellor at the University of Lincoln, an honorary member of the Institute of Psychiatry, president of the International Association of Philosophy and Psychiatry, and a governor at the London School of Economics. He has a MA in Advanced Organisation Consulting from Tavistock Institute and City University. So he's done a bit. Please join me in welcoming and giving a proper Toronto welcome, if you can, to Lord Victor Abadiwala.
Thank you. Gosh. Well, thank you very much, Kwame. I always worry about those sorts of introductions because I don't know whether my sense of humor is going to work, but I always think as I'm walking up, no pressure. You know, it's like, it's 4 o'clock in the afternoon. and I've got the death spot, basically. This is the bit that you're absolutely knackered. And it's like most of you are thinking, shopping? And this guy had better be good, you know. Especially the Wellesley Institute, because you've kind of paid for me to fly over here, haven't you? And it's like, and it wasn't easy, was it? It was really difficult. Not my fault, I hasten to add. So like the pressure's on, right? So there's got to be some chat here. No poetry, no slides, no film. I mean, it's just, you're making me work like a dog, right? So this is the thing, right? This is the thing. If you're me, and you've got all these gongs, these titles that they give me for doing things, what it does, and it's the only thing it does, is that it gets rid of my ego. My ego was assuaged, completely assuaged in about 20 years ago, because I got a CBE, and then they gave me a peerage, and then they give me all these things. And what that does is it gives you, I have no ego, so I don't care. If you all got up and went to the cinema, I'd just carry on talking. I'm just, you know, I'm not bothered. But the things I need to say to you, first of all, people, I don't know whether you care about peerages and stuff like that in Canada. I've had a few people say to me, refer to me as Lord Victor Adibawali as though I care. And others who just call me Victor but look at me a bit worried, like I might growl at them or dismiss them or point at them and they'll disappear in a puff of smoke, you know. So I've kind of wandered around and I've got to know you a little bit. So I consider that you're all friends now, and so you can just refer to me as Professor the Lord Victor Adibawali, CBE. No, Victor will do nicely. All right, I want to say a little bit about me, and then I want to talk a bit about Turning Point, a bit about collaboration, and try and pick up some of the things that I've heard during the course of today. But first of all, I just want to say something about Kwame, and it's such a pleasure to see you again, Kwame. I mean, we had a long walk the other day, and we talked, and I realized how much I miss you, because the thing about being Kwame that I always noticed about him is that you are, excuse the language, bloody smart, fiendishly clever, but you think differently. You've got an analytical way of looking at things, which is different. And I'm going to throw this out there, right, because it's true of me as it is of you. You think differently, because you have to. Right? You had to. I had to. Feast your eyes. This is a rare moment for all of you. I'll tell you this now. It is highly unlikely, as young as some of you may look, that you will ever feast your eyes on a 6-foot black member of the House of Lords with dreadlocks. It's not going to happen. Not going to happen. But I note that it is nearly as rare that you will find the chief exec of a major policy institute, as you are now, who happens to be black. Now, why is that relevant? Why is that relevant? It's not just because I like Kwame. I do. He's really cool. It's because of this. I spent 6 years on the board of the NHS. I've spent 20 years running Turning Point. I've been alive for 57 years. I am older than you. I'm older than everybody. Right? Oh, there you go. There you go, sister. We got some of that. It's proof, right? Proof. And I've noticed something. And that something was backed up by some research, which kind of goes to the heart of the matter, really. The fact of the matter is, if you have a situation, as you have in Canada and certainly in Toronto, where black people, and when I use the word black, you've got this odd way of talking about race in Canada. You use this word racialized. Now, where I come from, if somebody says I'm racialized, they're calling me a racist, right? And when somebody talks about visible minority, I'm thinking, where I come from, most minorities are kind of invisible no matter what color they are. So I don't know what you mean, right? But know this in healthcare, and I think it's true of virtually every area of public policy. If you do not have the representation of black people, and I use the word politically, so I don't just mean people that look like me, right? I mean the 51% of Toronto that, don't come from here, which is an odd thing, because I was saying to Kwame the other day, when people say 51% of Toronto don't come from Toronto, right? What they're really saying is that 51% depends on where you start. Virtually everybody in Canada is an immigrant, right? Virtually everybody in America is, but it all depends on where you start the counting as to who's in or who's out. So it's bullshit, right? Just park that to one side for a second. The point is, if you do not have representation of black people in leadership positions, it will impact on your ability to understand, care, share, and deliver services. Not just to black people, but to everybody. How do I know that? That could just be a guess. It kind of makes sense, really, doesn't it? I mean, I got to tell you, Kwame showed me this picture, and it reminded me so much of England. It was a photograph of the leadership of the hospitals. I'm going to offend somebody. Oh, hell with it, I'm just going to say it. A photograph of the hospital leadership of Toronto, right? I can tell you now, there's nobody who looks like me. In fact, there's nobody who looks like you. In fact, there's very few people who look like you. I mean, it was unbelievable. And it reminded me of England, right? And that's relevant because I did some work on the board of the NHS with a wonderful woman called Yvonne Coghill. And we looked at the impact. Well, actually, I did some work in the 1980s, did exactly the same thing, but actually it took a white guy, this is absolutely true, took a white guy to do exactly that same work. And what me and Yvonne did was that we saw this research and we thought, we've done this, but in order for it to be taken seriously, it's got to be presented by a white guy, right? And we got this white guy to present the research, and what he showed was that there was a direct correlation between the quality of care, the design of care, the quality of life of clinicians, care workers in health institutions that was directly correlated to the numbers of black people in senior positions. And in some parts of the country, England, and I know it's the case here, like Bradford, none of you have been to Bradford, it doesn't matter, I just know there's an awful lot of black people in Bradford, right? Or Lewisham in London, nearly 50% of the population. It looks like a mini version of Toronto. And you looked at the boards of the hospitals, the local authority, the senior positions in policy, not one black person. Why is that? Why is that? Okay, let me tell you why that is. It's because nobody talks about race. And race, like many other things that people find difficult to talk about, dictates the future. The future is decided by the things that you're frightened to discuss. Does that make sense? Does that make sense? So, my career, if you can call it that, has been riddled by the fact that I was born the son of a nurse in Wakefield in abject poverty. I was lucky enough to be born with a functioning brain and all four limbs. To parents who actually were reasonably smart and smart enough when they came to England not to go to a ghetto. And resilient. I hate that word, resilience. I've got to be honest with you. You know why I hate it? Because it's always applied to people who we don't give a damn about, and they have to be resilient. Have you noticed that? They have to be resilient because we don't care, so they have to be resilient. Just saying. Anyway, I was lucky, right? I was lucky. And that luck made me think. I was smart enough to think that it's not just my luck, It's the fact that there's thousands and millions of people that are unlucky. And that my life is connected to them. And virtually every single major policy change that I've read about or understood about was started by somebody who was lucky and then realized that they're connected. I said I was going to talk about Turning Point, I will, but let me tell you the story of the NHS first. Is that all right? I'll tell you the quick story. Because in that story, because I've only got half an hour, lies all the lessons you're ever going to need about change. So this is the apocryphal story of the NHS. 1948. Before 1948, there'd been a war. Some of you know, Second World War, devastation. Britain had no money. And ill health. I think the life expectancy of a man was in 60s, women 71, something like that. But, of course, when you look at life expectancy, you have to dig down to the people who are the poorest, right? According to this, I've got 16 seconds left. I'm not going to make it. So, we need to go to Wales. We need to go to Tredegar. And in Tredegar, there were working people who weren't absolutely poor, but they weren't rich. And they worked in the steel, and they worked in the mines, and they worked for the man on the hill, right? And they'd get illnesses, and they'd have accidents, and they'd die horribly, and they couldn't afford the doctor. So what they did was they got together, and they went to see the bosses, and they said, this is ridiculous. We're working really hard, spending all our money on healthcare, and it's just not working. Does it remind you of a health system not far from here? Think on. And the bosses said, I'll tell you what we'll do. We'll take some money out of your wages, and we'll put it in a pot, and if any of you get ill, you can take out of this pot, and you'll be fine. And they were really grateful, because the bosses were going to do it for them. They didn't have to think about it. So for a couple of years, that's what they did. Except they noticed they weren't getting the health care that they needed. And it didn't cover everything. So if you got your leg chopped off or you injured something physically, it might help, but it wasn't comprehensive enough. So they got together and they noticed that the profits went up, but their health wasn't necessarily getting any better. So what they did was that they organized themselves together and said, look, we're not giving the money to you anymore, we're going to keep it ourselves. We're going to create an association, a health and social care association that everybody pays into, each according to their need, and if any of us are ill, we can get health care free. Nye Bevan, who was from Tredegar and was a campaigner, went to Tredegar, saw this was working really well, and he gave a speech about healthcare. And he gave a vision for healthcare. Free at the point of contact, available to everyone, each according to their need. And he said, I'm going to Tredigarize the healthcare system of this country. And that's what he did. He modeled the NHS on Tredegar. Right? What does that tell you? It tells you the following things. One, there is no argument between what is small and what is big. I've heard that today. Start small. Focus on the small things. Don't worry about what the government... No. You have to do both. We wouldn't have an NHS if the government didn't use its authority to convene and communicate, spread. Wouldn't have happened. But equally, we wouldn't have had an NHS if the people of Tredegar didn't have the wherewithal, the leadership, the social capital to understand the complexity of their unique place and build a system that worked. You with me? Oh, God. 11 minutes. Okay. So I wanted to tell you that story because virtually everything that I understand about how change happens is kind of buried within it. Yes? So, a bit about Turning Point, very quickly. Oh, God, we've got a website, look it up. But we've done a number of things. We work with about 100,000 people, and we do substance misuse, mental health, learning disabilities. But let me tell you about the things that I'm interested in, that what we've done that might be useful to you. Evidence, things that work. So I did a lot of work with the government, and I noticed that in poor areas, they'd send me in to sort things out. But what I noticed was, in poor areas, and I think it's the case here, there was a social care department. There was somebody responsible for housing. There was some kind of welfare system. But you know what? There might as well not have been there for poor people. There might as well, even the language was different. And yet I was spending, as a taxpayer, a fortune on systems that didn't work, just didn't work. So I stayed there and I studied it. And I realized the following things. One, an awful lot of taxpayers' money is wasted on services that don't work, and that's because they're not bespoke. So it's the equivalent of the model, and this is happening right here in Canada, I know it is. It's the equivalent, I don't know why I'm pointing at you, just, you look cool. So, it's the equivalent of you walking into a shop to buy a dress. And before you've opened your mouth, the shopkeeper has said, I've got bin liners. You know, bin liners, things that you put in your, that's all I've got. And it's raining outside and it's freezing. And you think, hang on a minute, I'd rather go bare-chested than walk. I'm not wearing that. Right? So you walk out. Hell with it. Unfortunately, the taxpayer has paid for the shop, the shopkeeper, and the bin liners. And will pay for you to end up in A&E. Do you see where I'm going? You have to turn the pyramid upside down. And there are rules for doing that. So, what I decided were you needed to engage communities. And everybody talks about community engagement as though it's easy, just natural, particularly if you're smart. It's really easy if you're smart, right? So I've consolidated it, community engagement, into the following rules. Firstly, for rule number one, you have to listen. Now, Kwame is a psychiatrist. I think you'll agree with me that listening is really hard. It's exhausting. Furthermore, if you tell me that you're listening to me, it's irrelevant. I need evidence that I've been heard. That's rule number one. Rule number two is that there has to be a transfer of power, right? Otherwise, what's the point? And what does a transfer of power mean? It means that the people that you are engaging with, the community, have to be able to do something post the engagement that they couldn't do before. Right? Otherwise, there has been no transfer of power, and there has been no engagement. 3, at worst, whatever the problem or the intended solution is, has to be co-produced with the community. At worst. At best, the community has to define both the problem and the intended outcome. Think about the NHS. It wasn't decided in Whitehall. Everybody thinks it was. Decided in a little village in Tredegar. Yeah? And the final rule is that whatever you produce has to be describable. Now, I say this because in England we have this problem with people going to A&E a lot. And they go to A&E a lot because it says what it does on the tin. Right? If you have to, it's a bit like trying to, I was at the film thing last night, a bit like trying to flog a film. It's the elevator pitch. If you can't decide what the service does to your friend, brother, lover, mother, father, it's useless. Health and social care has to be instant. There's one other rule which I've discovered lately, which I consider probably the most important rule, and the answer to the problem which plagues every health system in the world, including this one. And there's only 3 challenges, really. Equity, access, and technology. And you have to deal with them in that order. If you start with technology, you end up with Babylon. I can explain Babylon maybe in the Q&A, but if we do, but you end up with technology designed by people who want to disrupt the healthcare system to inflate their share price. You have to start with equity, right? Equity, access, technology. But equity is driven by one rule, in my view, which is the negative and positive value transfer rule. Some of you will know what this is. Negative value transfer, very quickly. I walk into a bank. I want to withdraw, I don't know why I'm looking at you. I want to withdraw $10. I go into the bank, but the bank says, I tell you what, you've got to go to 10 different tellers and get $1 each. And you're thinking, hang on a minute, that's a hell of a waste of my time. And the bank has just bought 10 tellers to do what one teller could do. That's called negative value transfer, right? Some of you will have heard of $1 Million Murray, the story of Million. That's an example of negative value transfer. It's where the system feeds itself in the misery of people who usually can't afford to use the system, but are forced to go to different elements of it for the one thing. It's incredibly wasteful. It wastes billions. The poor suffer from it, the middle classes negotiate it, and the rich go private. Right? So the final rule is that you must have positive value transfer, i.e., when you walk into your healthcare system, it surrounds you. You go to one place. So the example I always give, God, I've got 5 minutes. The example I always give is a young man walks into a Turning Point substance misuse service. He's coughing his lungs out. I say to the doctor that we employ, who happens to be an addiction specialist, but nevertheless he's a doctor, he went through all that stuff. And I say to him, God, he sounds like he's got bronchitis. Shows you how much I know about, but coughing might be bronchitis, right? Doctor says, yeah, probably, I said, oh, that's great, we can give him some antibiotics. That's what they give to him. I'm looking at you because I know you're a doctor. You might be a doctor of geology, but you look like a doctor. And the doctor said, no, we can't do it. I said, why not? He said, we don't have a contract with the clinical commissioning group to do that. I said, what's going to happen to him? He said, well, we're going to send him to his doctor. I said, what are the chances of him going to his doctor? He's chaotic. He's complicated. What's going to happen? Well, about 2% chance of him getting to his doctor. So where's he going to end up? A&E. I said, how many times does that happen? The doctor says, well, we're looking after 3,000 clients, so 2,995 times. Do you see where I'm going? Expensive, wasteful, actually cruel. Why does it happen? So, it happens because we are generally afraid, and I say this, including, I've gone on a hell of a journey, to think systemically about where problems started. We talk about collaboration, but we don't do it. Collaboration requires effort. We measure competition. It just so happens that Canada is number 7 on the World's Competition League or something like that. We don't measure collaboration. Virtually every problem that we're going to face in the next 30 years cannot be solved by competition. I'm not against competition, but as the former chief executive of the NHS said, it should be used, and forgive this analogy on this side of the Atlantic, but it should be used like a sniper's rifle, not sprayed casually across the system. We should collaborate. And that's why I set up, we're not trained to do it. We don't really measure it. We don't engage with it. And what examples exist are generally the result of one brilliant person forcing it through the system. And when that person goes, it's dead. It's not systematized. So I'll end by telling you what I think is necessary for collaboration to work. Firstly, you need leadership. Now, it seems really silly, stupid thing to say, but it's a particular kind of leadership, a relational leadership, transformational leadership. Leadership that understands systems thinking. Somebody who's read Peter Senge's paper and imbibed it. It requires that leader to ask questions of the system while managing the ego to have all the answers. It requires teamwork. Now, you say teamwork, most teams enter periods of dysfunction because they don't start orientated around the same problem, therefore they don't trust each other. If you don't trust each other, then whatever objective is given to you, you will interpret in a survival mode because you don't want to get fired, which means that everybody will end up, and the more intelligent the team members are, the more clever they are at interpreting the objective in such a way. You've all been members of dysfunctional teams, right? That's what happens. That's why it happens. You need teams, but you need to understand how they form, really. And finally, you need to understand the dynamics of complex adaptive systems, which is what you've got right here. I don't want to get into complex, I've got 26 seconds left. But basically, complex adaptive systems are systems that are so complicated that it's very difficult to understand them. But what we do know about them is that small changes can make massive differences. And what is the smallest change that any individual can have on a system as a human? It's a conversation. It's a conversation. If you think about the things that have changed you, they've changed you in interaction with others, in relationship to others. But it requires discipline. So, in the last 6 seconds, I'm going to say to you this. We live in a world right now which is teetering on the edge of atomized data. Everybody believing whatever they want to believe, that they've pulled out of the internet. Flat earthers, Trumpians, right? We live in a world where it's easy to organize on either or. It's much easier to think either or. Either you're black or you're white. Either you're an immigrant or you're a Canadian. Either it's big or it's small. Either it's health or it's social care. Either. Either's dead. Either or is dead. The world is and. And I'll tell you this, the next generation understand that. And they are not going to wait for us to get with the program. And nor should they. So, I'll leave you with this thought. The work that you're doing and will do is urgent. So, somebody asked the question, what should individuals do about climate change? 2 seconds. Climate change. And what can we do individually? And I whispered under my breath, wake the fuck up. Right? The fact of the matter is, if you don't wake up, do you think the generation behind you are going to let you sleep? Greta Thunberg is a phenomenon for a reason. Right? So the work that you're doing here is urgent. It's urgent for your survival, professionally, personally, spiritually. You've started the work. You cannot stop because you can't be half pregnant with this stuff. You have to finish. Not for you. Not for the people in this room. You all agree. This is an easy gig for me. You have to succeed for the people who aren't in this room. Thank you very much.
Perfect. I have nothing left in my script, do I? I'm done, eh? How perfect. So, just make sure.
Yeah, I'm overdressed, I know.
So, we've heard a lot today, and I'm not going to go over what we've heard today. I'm not going to go over the, we've heard people's ideas, you've had conversations, we've harvested ideas, we've had a challenge to actually move from talking to doing, that this is urgent, that we have to think about this. We have talked about collaboration, we've talked about racism, we've talked about changing the shape of who is leading organizations. And from the conversations, the workshops, and for your postcards, and more postcards if you have time, we plan to take back what we've learned here today and use it to inform our work. We're going to have a reception now, and there's going to be a performance by Greg Rittle in France and in the quad just outside. But I'd like to just finish by thanking you all for coming. I can tell that between Ranziba and Michael and the team at the Wellesley who put this together, from all of the people who've spoken and given their time, no one's got paid, everybody's done it for free, and from the fact that so many of you are still here at this time today, that it was all right, I think, yeah? You did all right, yeah? We'll talk about it in your review. We do need to thank Hart House for allowing us to be in the Great Hall in this fabulous space. We've got some engineers who've been doing the sound and all of the panels on the plenaries have been videoed, and we should really give them a hand. And of course the catering staff. And I really want to say a little thing about volunteers, because people have volunteered their time, done more than they need to be here. All the staff have been pulling out the stops to make this happen. And you can imagine that trying to produce a production like this in a small charity is not a small feat. And so I really wanted to say that, because I'm incredibly grateful that you guys have made us look so good. But I would like you to continue to enjoy, to continue with the buzz that there's been all day, continue with the networking, continue having those discussions about what you're going to do next and how you're going to move this from ideas to action. And we hope to see you at the next Wellesley event. And once the team recover, we'll be in touch with you with the outcomes of today, and also connecting you with ideas of how we can push your work forward. So thank you so much for being here. And we have a reception, and there's going to be more of Greg, there's going to be more poetry. Thanks very much. Bye.